Hi, it's Will Shannon, and I'd like to talk about naturally treating people who are passing out or losing consciousness. There's really two areas naturally that we would treat this with. One, we would always treat the brain. And again, I always give a disclaimer on these now. Check with your medical doctor, your health practitioner. It's simply advice only, and I don't know the unique case. But giving a broad overview, number one, we'd use, and you can certainly bring them in and see me if you'd like personally, so I can tailor something customized. But overall, we'd use something for the brain, and we'd look at herbs like ginkgo and brahmi and rosemary, which is a spice you can even use in your cooking. And we'd then look at cleaning out the liver, because the liver detoxifies all these poisons. And we'd look at minimizing neurotoxins. You do not want to be putting alcohol in your body if you can avoid it. Unfortunately, some people are happy to lose consciousness because they did want to consume alcohol, as long as they only lost consciousness occasionally. Cigarettes. Now, what I mean is you're not going to lose consciousness directly from drinking alcohol, but it certainly contributes. Other neurotoxins would be trying to look at minimizing pesticides in meat and animal products. Even fish, unfortunately, that carries a lot of these products. We'd put everyone on an ideal day lifestyle, and we'd also then look at treating the circulation system, the cardiovascular system, and making sure that the circulation is good. So the liver, putting them on hawthorn for the heart, horse chestnut, which will get rid of their varicose veins as well. I would be looking at treating the renal system and getting everything out, and we'd use the triad of treating the brain, the circulation, the kidneys. So if they're just going to order medicine, we'd give them a kidney mix, a cardiovascular mix, and a brain mix. And people always did an intestinal detox with that. So what we'd probably do is we'd prioritise two of the three. So what we would probably prioritise is we wouldn't start off with the cardiovascular mix. We'd go intestinal, brain, and kidney. We'd get people drinking water, minimising some of their lifestyle choices such as smoking and alcohol and meat. Even if people can get moving and exercising a little bit, that can often help, providing it's in a safe limit, because you want circulation to be working properly. Why do people pass out? I mean, that's a mystery to a lot of the medical profession. If you're going to chunk up, even though it's unique in every case, you're going to chunk up to the broadest level, it can be a circulation problem. It can be acids, poisons, toxins in the brain. It can be a weakness in that part of the body, like a predisposition like seizures or epilepsy. And again, remember, naturally treating, we always use the overview, because no matter what's going on with the brain or the liver or the kidney, the herb will strengthen that organ. So it's not like a drug where you go, oh, do they have hepatitis, or is it a fatty liver? Whatever it is, it seems to assist the liver. Apart from that, I can't really add much more, other than the fact that, certainly you want to be conscious when people are driving with this. And the other thing is, it can simply just be a lack of oxygen, and sometimes breathing exercises and things like that can help effectively. But really, we want to tailor a program, and I'd do it probably in 3 steps, where we start off repairing the brain, the kidneys, then we'd look at the cardiovascular system and getting them moving, and finally some breathing, and even sweating in a bathtub, getting that oxygen going, and getting them to the point where they don't have to live with that uncertainty of having seizures or losing consciousness or doing anything. Whenever there's a brain weakness, we really want to prioritize that, because people can also get some mental challenges. And naturally, we're looking at what's the weakest part of the body. Cardiovascular system, it could be the veins, the liver, or I can't digest meats. The kidneys, they're retaining fluid. So if one of those is the brain and cognition, that is definitely one that you do not want to be in your 1 or 2 weakest organs, because by the time you're losing consciousness and having seizures, or tell a natural health practitioner you have a weakness in that part of the body, it's important that you address that immediately.